Hello, I'm Jenny. I'm the Recruitment and Retention Lead Midwife for Northern Lincolnshire Goole NHSFT, work at Grimsby, Diana, Princess of Wales Hospital and Scunthorpe General Hospital. I'm also the lead for the Grace Project Work Placement programme.
Hi, my name's Grace. I'm currently a student midwife here at North Lincolnshire Goole Trust. I'm currently doing my placement at Diana, Princess of Wales Hospital on community and maternity and family services, and I was a big part of the Grace programme. So in school, I wasn't very academic. I loved my English, loved all the crafty sort of lessons. I wasn't didn't find myself very good in maths and science. So when I went to college, I studied the BTEC Health and Social Care course at Grimsby Institute, which luckily supported me in maths and science, as it was a requirement to follow the career I wanted to follow. And midwifery sort of came to me just through the years. I've wanted to be a midwife for as long as I can remember. I can't specifically say anything sparked my passion for wanting to be a midwife. It was just sort of the case of following job roles through my time at college studying, and nothing sparked the passion for midwifery as I hoped. So I found out my neighbour was a midwife through looking after her pets while she was away. So it all started with a cat and a key ring, basically. She had a key ring that said, "I'm a midwife," and I was just absolutely delighted. So when she came back off holiday, I went and had a chat with her to discuss my passion for wanting to do placement within the trust here at Diana. The girls in my cohort from college were already doing placements at care homes and nurseries. So I was really intrigued to see what could be done about getting placement back in the trust after the COVID pandemic. So she took it upon herself to sort of correlate what we'd spoke about into the hospital.
So I started my post that I'm in at the moment in September 2022, and I was very much aware that since the pandemic there was very little opportunity for placement unless you were a student midwife or a student nurse or a student AHP within the trust, so it's quite limited. And at that point I was approached by one of my colleagues who was the neighbour of Grace, and she mentioned to me about potentially starting up a placement opportunity for students from Grimsby Institute for higher education. And it all kind of stemmed from there. I had a discussion with our colleague from the practice development team, and I also liaised with our placement coordinator at Grimsby Institute for Higher Education, and it's just snowballed from there, really. So I looked into the possibility of placement areas for the students from Grimsby Institute, and obviously the programme needed a name, and I just felt it was because of the passion that Grace had and the proactiveness of seeking these opportunities for not only herself but her fellow students at the Institute. It was only appropriate to name it after Grace, which is why we have named it the Grace Programme.
So, as we know, the Grace programme is named after myself. However, it's also an acronym. So the G stands for gynecology, the R is for paediatrics, the A is for maternity services, C is for community, and the E is for breast care.
And these are all the areas of placement opportunities for students to attend when they are part of the Grace programme. We wanted to extend the placement opportunity to the nursing side of things as well, because the students that were in Grace's cohort didn't necessarily know if they wanted to be a nurse or a midwife. So we felt that opening up that opportunity to see different aspects of nursing and midwifery could help make that decision for their career pathways for the future. So what we decided to do was base it more around a women's health placement than a midwifery placement. So the placement opportunities that we offer to the Grace programme, they differ depending on whether they're in the first or the second year. So our first year student placements here at Diana Princess of Wales, we offer community midwives, antenatal clinic and antenatal day units. That's these high and low risk women in the stages of their pregnancy prior to delivery. They also go to the Pink Rose Suite, which is our breast care unit. So they will see ladies that are service users for that department as well. And we also have our gynecology department. So they'll go to our gynae outpatients and also the gynae assessment area, which is placed on our same day assessment unit. The second year, they progress to more ward-based areas, and that's purely because of the safeguarding aspect that comes into play, and they also have to be of the age of 18 to be able to access any paediatric areas as well. So we've progressed to second year now, having placements on the maternity ward, which is our family services building, so holly, blueberry and honeysuckle. And then we also have our rainforest, which is our paediatric ward in with that as well. As there was no placement programmes in place at the time, but had been in the past, I knew it was something that potentially we could start up again. So it was a case of me sending out lots of communications to anybody that I thought might be able to support the placement opportunities. So I first of all ensured that I got permission from our head of midwifery and our matrons for the areas, because without their permission we wouldn't be able to do it. And then I emailed the managers for each area to ask if they would be interested in supporting the programme, but most importantly, if they're able to accommodate the students, because I am very aware of the number of students that the areas have already taken on. A lot of the behind the scenes work in relation to setting up the programme with Grimsby Institute was done by my colleague in our practice development team and Tia within Grimsby Institute. So they did a lot of the magic that I wasn't made aware of. But it was making sure that areas knew the expectations of the students, what they can do, what they can't do. And it was really important to emphasise that there wasn't the expectation that they would have to work with a qualified practitioner. I wanted to make sure that our students that were coming to us understood the value of our support workers as well. And they are really ideal people to actually shadow in these areas, because they have such a vast knowledge of what needs to be done in the settings that midwives and nurses don't necessarily always get that ability to do. All of the students that wanted to be on the Grace programme were interviewed in a sense. The first time we did it, we kind of just did like a question and answer session. And I'm not going to lie, they threw us some real big curveballs with some of the questions that they asked us, which definitely put us on the spot at the time. And each year that we've done it, those questions have definitely enhanced, and their passion or the types of things that they want to know has definitely shocked us, but in a good way. When we started the Grace programme, we had 4 students join us from Grimsby Institute. There was 2 T-level girls, so there was some T-level students for the start of the programme, but Grace was not one of them. She was on the BTEC, and I believe the other student was also on the BTEC programme as well. We started in January 2023, and we're going into our 3rd cohort of students now in 2025, and we've actually progressed the programme through to Northern Lincolnshire Council as well. So we won our Grace programme with Scunthorpe General Hospital, with North Lindsey College involvement, and we've just added John Leggett College into that equation as well. So over the last, what will be 3 years in January, we'll have actually accepted 20 students through the programme, which has been really amazing, considering it was just a discussion with Grace and a neighbour back in 2022. What we have seen throughout the programme and how it's benefited the students is our first cohort of 4, 3 of those students are now studying at university for either their nursing or their midwifery. So as Grace has said, she's actually just started a first year of her midwifery training, and 2 of the other girls are in their second year of their nursing training at the moment. So for me, that is the biggest compliment that we could have had for the programme, because it's shown that actually the 2 girls that are doing their nursing degree were unsure about what avenue to take, and they've decided to do their nursing degree with the prospect of going to do the midwifery later on in their career. So the programme actually really was beneficial for them to decide whether or not to try and do their nursing first or straight to midwifery. And also it was really beneficial to Grace, because Grace knew that she wanted to be a midwife and not a nurse. I think one of the real big positives that the Grace programme has had for our trust is the fact that, as I've said, we are recognised nationally. So that's really built up that reputation of our trust, that we are doing something that's very positive and beneficial to our local community. And that's really important to kind of spread the word for other people, and hopefully it will encourage other employers and other workforce providers the inspiration to offer that to other people and open up those opportunities to a wider variety of placement opportunities.
So I was super excited that I was about to start my placement here with the Trust. However, I was incredibly nervous. I'd never been opened up to a hospital environment before, so I was really apprehensive of even what my first day was going to be like. But yeah, I was definitely excited as well. Definitely did a bit of research into a midwife's role a bit further. Especially at college, you don't really delve deeper into like each individual healthcare practitioner's role, as it's so incredibly broad. So I definitely wanted to sort of see what my area was going to entail and what sort of I'm going to be involved in. So I'd say that I definitely did a little bit of research to help myself. Oh, absolutely loads. So depending on who I was working with in the day, I'd sort of shadow them and get as hands-on as I possibly could with their activities that they were completing throughout the day. Like Jennie previously mentioned, because some of the girls in my little cohort were undecided whether they wanted to do midwifery or nursing, and because placement was like a scope of women's health, I was obviously on maternity services and sort of scoping a nurse's role as well with that. So I've been in maternity and family services. I've been in the antenatal day units. I've been on gynecology. I have been with the midwives out in the community in Grimsby, as well as doing postnatal visits with them as well. I have been up on Laurel Ward as well, in our maternity unit, and obviously in my second year, I was up on the labour wards with the midwives, doing that as well. So whilst up on placement on the labour wards, a highlight for me of my time up there was actually observing a caesarean section, which just blew me away. It was so incredible, and I absolutely loved it. I hope to be a midwife. Hope to, fly through the next 3 years and qualify. I should be qualifying in 2027. So